cannot ban Black people from your hospital and then ask them to trust your hospital brand. You cannot refuse Black customers at your restaurant chain and keep your stock price intact. You cannot build a university that excludes Black students and then recruit Black athletes, retain corporate donors, and operate in diverse cities. The math ain't math. Laws matter. Activism matters. Voting matters. But let's be honest about what made a lot of corporate America move. It wasn't conscience. It was the calculation that exclusion was more expensive than inclusion. I'll bring this home to what I know, which is healthcare. Black Americans are underserved by the healthcare system at almost every level. Worse outcomes, less access, more medical mistrust, and guess what? Hospitals and health systems are now spending hundreds of millions of dollars trying to fix that relationship. Not just because it's right, but because Black patients represent an enormous share of their patient population. Their Medicaid, their Medicare reimbursements, private insurance. Hospice care is one of the lowest utilization rates in Black communities of any healthcare service. My entire business is built on closing that gap. And I can tell you from the conversations that I've had, health systems want Black patients engaged, not because they're suddenly become enlightened, but because the data on their patient demographics is undeniable. Money is talking in rooms where morality wasn't enough. So here's what I wanted you to take from this. Your money is power. Not as a feel-good slogan, as a structural economic documented reality. That means where you spend matters, who you bank with matters, what companies you support matters, because the thing keeping institutional segregation from making a legal comeback isn't just the Civil Rights Act. It's the fact that American economy is too dependent on Black participation to survive it. Use that knowledge wisely, invest in some Black businesses, and pull your dollars together when companies disrespect you. I'll end on this. My name is Henry Mason Jr. I own a hospice here in Atlanta called Precious Hospice. Just think, if every Black person in Atlanta decided to use Precious Hospice, we would essentially cut the market share by at least 20% of every other major hospice in Atlanta, like that. My biggest actual doors and the ones that are hardest to get in are not the people. It's a lot of the hospitals themselves. They're the ones who understand this model and do whatever they can to keep people like me out. Is there something that you can do, something that we can do together? Absolutely. Just like you would support any Black-owned restaurant, you should be supporting a Black-owned hospice. Not just because we're Black-owned, but the next time you go to a specific hospital in Atlanta, they're going to hand you a book with the hospice on it. Look up their hospice's Google rating. What you'll find is their Google rating is less than half of my Google rating, which means that people actually have been forced to use a company that, one, they don't like, and two, I'm not willing to say that they actually like you all either. Do what you will with that information. Thanks.